One of the main questions I get asked is, when can I stop doing the oral play? And my short answer is always never. You should never stop doing oral play. The tongue is such an important muscle. It drives what the rest of the body is doing. It can impact the rest of the body, all the muscles down to the toes. It is often forgotten. And in a society where we eat soft foods, the American diet is so soft that our tongue is not using its potential, and our mouth and oral mechanism is not doing what it was intended to do. And so oral play can be a bridge in that. It can decrease tension. It can support nasal breathing, and it's just so important. Doing it every day. And let's go back, because a lot of times people are using the oral play guide as a wound care guide. And while it can be used for wound care, it is completely different than wound care. While it can be used for pre-release, it is completely different than pre-release exercises or motor planning. While it can be used to improve feeding, whether bottle or breast, and you use it throughout the day when you're trying to improve those things. Once those issues are resolved, the goal of oral play is to maintain hygiene, oral hygiene by keeping that mouth closed and nasal breathing, body hygiene by keeping the muscles functioning the way that they should be functioning. And so keeping tension low. We are constantly moving our bodies odd. Kids are going through growth spurts all the time. They sleep funny sometimes. Maybe they move and learn something new in gym or PE or whatever the case may be. Us as adults have learned to live with pain. It's like an amazing thing that you don't even realize the pain that specific muscles are in until something happens and we call attention to that specific thing. How many people I work with who have jaw pain and they don't even know it until we start to work on it, because they get headaches. We start to work on it because they're mouth breathers, and now their brain is attuned to the weakness and the pain and the tension within that muscle, within the shoulder muscles, within the back muscles. And so I remember when I was doing pelvic floor therapy, I didn't even know how tight my hips were, right? Like the brain is such a powerful tool that is used for survival, but we push so much on the back burner, and we put our bodies through so much that we don't even realize. So oral play can start off as a goal, but what I want it to become is for the kids to start imitating those activities, for them to then start needing those activities, for them to wake up and realize that their shoulder or their head feels funny and start to move their body in a better way to relieve tension if they're having it. My 4-year-old will now come up to me and ask for oral play, and they call it stretch. Can you stretch my tongue? And it's because they can't pinpoint exactly why, but they know that when we do a good stretch, that maybe they feel better. Okay. And so I want you to once you move past the goal of why you intended oral play, but this is why I say oral play is for every single baby in the world, because whether you have a problem that you use oral play to help resolve, or you're just living life, I want you to take those activities. It doesn't have to be all of them. The guide has lots of them so that you can pick and choose which ones suit your child better, which ones they tolerate better, which ones seem to have the biggest impact. And you learn them all, and then based on what you're seeing, you can adjust their oral play for that day. And so pick a time, and we're going to incorporate it and imagine that is just as important as brushing their gums and their teeth. It's just as important as feeding. It's just as important as bathing. It's just as important as getting them dressed. It becomes part of a routine that you do for a healthy lifestyle. And so, and it can be 30 seconds. Because I am alone in this. I wake up with 3 kids and have to get them ready and do all the things. And so I understand time, and I understand chaos. Okay, my house is chaos. And so when we do it is in bath. When we take a bath, we do oral play. They can imitate someone their own now. We make it a game. One person picks one and the others have to do it. But it can be as quick as 10 seconds per kid where I'm doing it just to release tension in their body. Or it can be a minute. It could be 3 minutes. It could be 10 minutes and they're playing the game with the activities, right? So it might sound absurd, but once you do things over and over and you've established that routine and that expectation, it's not weird or odd at all. And the day that your toddler comes up to you and says, I need to stretch, it's gonna be what's the word I'm looking for? The intunement that they have with their body should just make you feel so good, because I don't even have that with my own. We didn't grow up doing yoga and activities for our body and making sure that we were moving right or sleeping correctly or eating good, hard, raw veggies. And so oral play, I do it on myself. I can feel my own tension releasing. Adults who get released have so much tension built up and they don't even realize it. And so when your child becomes so attuned with their body that they can feel these things, it's a beautiful thing that they can carry on with them forever. It's just important. And so that is my stance on when can you stop oral play. If it's for a goal, you can stop doing it frequently throughout the day. But if it is just for lifestyle, then pick a time that works best for you and incorporate it in there. I know some people who do it before bed. I know some people who do it when they wake up. And what a beautiful way to start your day. You wake up, you sit around, you take 30 seconds to a minute to 2 minutes, and you just stretch and allow them to release any of that tension that's in their body that they're holding in their jaw, and just relax. And so it may feel like another thing you have to do and how ridiculous, I'm going to do this forever. But it's about a lifestyle. It's about teaching them to listen to their body. And it's about really giving the tongue the respect it deserves. But that goes with other things like getting those raw veggies and fruits. Like all of that is really important. If you are a meat eating family, those meats are really good to work those muscles the way they were intended to. And that is a whole nother conversation to go through when we're talking about oral hygiene and building good, healthy, strong mouths. So if you're interested in that conversation about diet and how we can help support building those healthy mouths, drop a comment below and I will add that to my list of topics to discuss. I hope this was helpful. Be sure to subscribe so that you can get all the information when it comes out. And I will talk to you guys later. Bye.